Thank you for joining us for this important webinar. Hawk Mountain Scout Council sees our summer camp operation for the 2021 season as essential for both our campers and adults. This webinar will contain a lot of information, so please stay with me as I go through it. We will hold all questions to the end. If you want, so you don't forget, you may want to put the questions in the chat box and I will answer them at the end. If you are viewing this webinar after the dates they were shown, you cannot put questions in the chat box. We have been hard at work exploring every avenue available to us to provide a life-changing program while supporting the mission of the Boy Scouts and the greater Scouting movement. As you are aware, attending camp activities is important for our youth development. This has been a hard year for our youth and many are suffering because of it. It is our goal to provide our campers with a sense of normalcy so that they can collectively recoup some of what they lost this year and get back on track. At this time, science has helped achieve a new level of clarity in how we mitigate risk through non-pharmaceutical interventions, or NPIs. These are mask wearing, social distancing, ventilation, quarantine, and isolation. The BSA has accepted these NPIs in stride and has implemented these NPIs throughout our organization and our programs. Based on current research done by the American Camp Association on their member organizations, interventions many camps employed in the past year have made a difference in the number of positive cases at camp. In all, the ACA found that only 102 participants and staff of approximately 90,000 in the study tested positive, which rounds out to about 0.1% of all participants and staff. The American Camp Association is a group that provides standards for camps across the nation. They cover religious camps, YMCA camps, soccer camps, sports camps, Boy Scout camps, Girl Scout camps, both day and resident. Last summer, 3 of our 4 national high adventure bases opened to participants with comprehensive mitigation plans. Through their summer operations, they experienced very few isolated and incidental cases, with no reported cases of community spread among participants at any base. HMSR has also been providing Merit Badge weekends, Cubs and Bugs Day, OA work days, MYLT, DVOA orienteering badge weekend, and many more activities at camp, improving and refining our COVID action plan as we've gone along. Another notable finding was that layered NPIs continue to be the most crucial factor in limiting spread. Hawk Mountain has taken these statistics from the ACA, as well as information from BSA, the CDC, and the Pennsylvania Department of Health to create our COVID plan. Terminology. The purpose of the terminology section is to make sure we're all on the same page and we understand what we are referring to when we talk about different words. So for example, visitor. A visitor is a member of the public who is not registered for any of our Hawk Mountain programs or a member of the staff. Camper. A camper is registered members of the BSA taking part in the program offered at Hawk Mountain. Adult advisor or troop leader are registered adult members of the BSA, usually from their home unit. All BSA members must be registered, have completed their YPT, and have all of their state background checks. BSA unit includes scouts, BSA troops, Cub Scout packs, venturing crews, explorer posts, Sea Scout ships, and STEM Scout labs. These units meet regularly throughout the year, planning and participating in a wide variety of scouting programs and working towards advancements. Staff. HMSR employs approximately 60 to 80 seasonal staff for the summer. We also employ 2 full-time personnel, the program director and the ranger. and we also hire volunteers. The program director, who is me, is responsible for the overall operation of the reservation. The ranger, who is Kevin Hunnicky, is responsible for the overall physical camp operations. A cohort. A cohort is a small group of people which, to the extent possible, remain consistent throughout the duration of their time at camp. MPI are non-pharmaceutical intervention, are precautions which can be put in place to mitigate the transmission of any communicable disease. Layered MPIs that are effectively put in place have proven to be very effective in decreasing the chances of transmission of communicable disease between individuals. Quarantine. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. Quarantine is a precautionary step to help slow the spread of COVID. Isolation. Isolation separates sick people with a contagious disease from people who are not sick. Isolation is a step which helps slow the spread of COVID. Preventative steps and precautions. General precautions. At this time, we plan to begin our summer 2021 operation on Sunday, June 20th, with our staff arrival and preparations beginning throughout the month of May and early June. The safety of our staff, campers, and adults will dictate whether we can or will open according to the current plan, or will implement further delays/changes. Campers and adults will be asked to use the Bsa Pre-Travel Screening for COVID-19 for a minimum of 2 weeks prior to their trip to Hawk Mountain. Our COVID action plan is fluid and will change as the science and recommendation changes. We will do our best to make sure that we post any changes to this policy on the Hawk Mountain Scout website, as well as included in Scout Wire and on the Facebook page. Hawk Mountain operations are subject to factors including but not limited to the CDC travel guidelines and guidelines for overnight camping, the Pennsylvania Department of Health guidelines and orders, the Pennsylvania government travel and social distancing requirements, the BSA outdoor COVID recommendations, and the ACA field guide for camps. All campers, staff, and adults taking part in any program will be required to agree to abide by the general precautions being put in place to help prevent the spread of communicable disease by signing a copy of the Hawk Mountain Communicable Disease Prevention and Waiver Form. Some of these precautions will be outlined below. Campers, adults, and our staff who show disregard for these precautions will be asked to leave Hawk Mountain. Specific screening, testing, and vaccination requirements for campers, adults, and staff may vary in response to a variety of factors. Many of these details have not been specifically approved at this time. Restrictions for specific individuals. Depending on the level of risk, campers, adults, and staff identified as having an increased risk for severe illness by the CDC due to age, pre-existing medical conditions, or other factors should seek guidance from their healthcare provider to decide if coming to Hawk Mountain is advised. Additionally, we are recommending that anyone who has been hospitalized for COVID since the onset of the pandemic, or who has tested positive in the last 6 months, should be cleared by their physician before their arrival at camp. We are also recommending that individuals considered high risk by the CDC guidelines who decide to come to camp should be fully vaccinated at least 6 weeks before their arrival date. These advisories are intended to limit severe cases of COVID infection and complication. Pre-arrival communication and screening. The screening process will begin with an email communication sent 2 to 3 weeks before your scheduled date to arrive. The email will outline the screening process, advise you not to come to or bring any participants who have been ill, are demonstrating worrisome symptoms, or have had someone in their home who has been ill recently, or who have been exposed to an individual with a confirmed COVID diagnosis. This email will also give you tips on how to stay healthy prior to your arrival, clarify your arrival time, and the flow of our revised check-in procedures. Campers and adults will ask to be used the Bsa Pre-Travel Screening for COVID-19 for a minimum of 2 weeks prior to their trip to Hawk Mountain. Troops and campers will be asked to bring some essential items with them to camp this year. Masks, we ask that you bring enough masks to be able to wear a clean one daily. At least 2 small bottles of hand sanitizer, 1 pack of sanitizing wipes, and several small hand towels, 1 for each day, so that one can be clipped to, but with a carabiner to your backpacks. This will help us kill too many trees in camp, as we will be encouraging increased hand washing. Arrival screening. Signs will be posted and staff will be assigned to the parking lot and at the Welcome Center to direct you. You will be asked to follow their instructions completely. This is not optional. A staff member will greet you and proceed with the screening process. This must be completed prior to continuing to your assigned site or entering any facilities to begin check-in. After asking the questions included with the screening process, the staff member will use a no-touch thermometer to check each camper/adult's temperature. Any temperature at 100.4 or above will be considered a fever. If any camper or adult answers yes to any of the screening questions or is found to have symptoms that are concerning during the screening, the staff member will ask your group to remain in your vehicle and will contact a health officer. Visitor policy. There will be a very limited visitor policy this summer at camp. All visitors must pre-plan their visit and make an appointment. Visitors include parents, relatives, staff members, and CAP visitors. Any visitors to the property who are going to get out of their vehicles and walk around. No visitors will be allowed without a full Part A, B, and C medical form. Mandatory reporting of illness. Campers, adults, and staff must report any known illness or symptoms indicative of a possible COVID infection to the health staff immediately. Social distancing. Hawk Mountain will be restructuring our meal service, limiting the number of individuals allowed in a confined space, and more. We are asking all to maintain physical distancing of at least 6 feet. Masks and facial coverings. Everyone at Hawk Mountain will be required to wear facial coverings at all times when around other individuals. Please see the CDC website for information on what masks are recommended. Masks will not be required while eating, sleeping, or participating in water-based activities. Regular temperature checks. While temperature checks alone have been proven to be ineffective in themselves, they can be useful when used with other layered MPIs. For this reason, Hawk Mountain is prepared to carry out daily temperature checks. Troop leaders will be asked to bring their own no-touch thermometer and monitor their group temperatures daily. If they do not have a thermometer, the health officer will set up a time when they can meet for temperature checks. Contact and unit tracing. Hawk Mountain is requesting that all campers and adults notify their troop leader immediately if they test positive with COVID upon returning home. Troop leaders must notify Hawk Mountain immediately, and we will take care of any notifications, contact, and unit tracing at that point. Health Lodge operations. All of our Hawk Mountain staff, seasonal staff, and health staff will be receiving additional training in COVID treatment protocols, and personal protective equipment will be provided for our healthcare staff. There will be restricted access, limiting the number of guests, and no indoor waiting room. Masks will be required on patients and provider at all time, other than if it is harmful to the patient. There will be a designated COVID treatment area. Daily screening of health staff and staff, including temperature checks and symptom surveys. PPE and vehicle decontamination procedures will be provided for any driver who transports a patient in camp. Staff will be required to change into scrubs in between assisting patients. The Health Lodge will be limited to anyone but the health staff and their patients. We will be moving our operations outdoors when we are able. Site operations. A scheduled cleaning regimen will take place in sites and will be conducted by the adults living in that site. The following sanitizing solutions will be provided: SaniQuad sanitizer, bleach water solution, sanitizing wipes, and soap and water. Adults should daily clean touchable surfaces in their sites. Latrines, the bleach sanitizing spray should be used at least once a day. Instructions will be provided when you arrive. Tents. At this time, we are following a one person per tent policy. Siblings may share a tent together, but parents may not share a tent with their daughter or son. The decision to put just one person in a tent policy was made with much discussion. Currently, we are not following the cohort plan at Hawk Mountain, which means we are not asking you to go by troop to every merit badge site or every program site. We are allowing you to split up and go to different program sites. Because of this, we wanted to layer our MPIs. The best way to explain this is kind of like a Swiss cheese explanation. So for example, you have a piece of Swiss cheese and there's holes on it. Let's think that those are MPIs. So you have one Swiss cheese. You take another piece of Swiss cheese and put it over the top, which is your second MPI, and it covers up some of the holes, but it creates new holes. And then you take your third piece and you put it on top, and you can see it covers up those holes, but then creates other holes. So you can see how that works. For us, the tents were just too small to put two people in. They're not 6 feet across from bunk to bunk. And we know that kids like to sit on their bunks and talk with each other, share their M&Ms after the trading post, whatever, and they wouldn't be 6 feet apart. We will look at this prior to camp starting, but right now that's our policy. Hand washing. Sinks will be added to program areas to help reinforce the importance of hand washing. Locations of sinks will be pointed out during your camp orientation. All sites and program areas will be provided with soap and instructions for proper hand washing procedures. Shower houses. Times will be assigned for showering during your check-in process. Adults may be asked to assist with the cleaning process. Staff will also periodically sanitize the shower rooms with the fogger and allow to air dry throughout the day, so sometimes they may be closed. Bathrooms at the Welcome Center, at the Cub Pool, Reary Pool, and the Comfort Station may at times be closed due to cleaning throughout the day. So please be patient with us. Trading post. Trading post operations will be modified to comply with current CDC guidelines. Some procedures will include surfaces being sanitized every hour, hand sanitizer being required upon entrance and exit, windows and doors remaining open during operational hours, occupancy limits. Some operations will be moved outside, and all drinks and food will be prepared by staff and not self-serve. Program areas. A cleaning regimen will be utilized to ensure that equipment is clean between each use. Staff will be responsible for the cleaning process, documenting that it has taken place. This list has been hard to create. Every tool, every helmet, every carabiner, radios, firearms, archery equipment, boating, oars, leather goods, all have different procedures for cleaning and disinfecting. We have a list provided for staff so they'll know what they need to do it. And I'm not going to go through the process of exactly what will be done at each area, but we'll get started. Hand tools. So any and all wooden handled tools, conservation project tools, leather making tools, any area that uses hand tools for program delivery will be cleaned and sanitized between each group. Climbing ropes, harnesses, gear, carabiners, figure eights, ropes, etc. will be cleaned after each usage. Helmets need to be cleaned and sanitized also, but they take longer to dry and we don't want to put them back on people's heads if they're still wet. So what we'll be doing is we'll be buying protective headwear that you can put on your head prior to putting the helmet on your head. We will clean the clips and the pieces that go under your neck, but then we will clean the inside of helmets once a day. Firearms will be cleaned between each use. Sanitizing wipes are safe to use on them, but all firearms will be cleaned and logged daily. Archery equipment, bows, arrows, guards, targets can also be cleaned between each use. Fishing programs, poles, reels, fly tying equipment will be wiped down in between use. Eye protection and ear protection will be on hand in a rotation process and will be cleaned between each use. Pool will be sanitized between each lesson time. No pool toys. And polar bear will probably need to be split between both pools. Boating, all paddles and high touch surfaces on the boating equipment will be cleaned and sanitized between usage. All camp activities like polar bear will be looked at and changed as necessary to ensure all camper, adult, and staff safety. Dining procedures. Our objective is always to deliver a full mealtime experience while operating within the guidelines of the Pennsylvania Health Department. This year, we'll also be working within the guidelines set by the CDC for COVID transmission. The staff will prepare food at Willett's Dining Hall and Kitchen. Our staff will be following all of the safe serve policies and procedures as well as the CDC procedures for commercial kitchens. All high touch services will be cleaned and sanitized after each use. No visitors are allowed in the kitchen. All staff will wear masks in the kitchen and changed into a clean t-shirt provided and apron. Meals will be served as a carry-out service. Breakfast will include cereal, milk, juice, yogurt, and a hot option. Lunch will be grab and go from the dining hall, with campers and adults being able to eat outside on the grass or pavilions or at their site. And dinner will be a hot meal that will be picked up at the dining hall. So both breakfast and dinner will be picked up at the dining hall. Leaders may drive a vehicle down to Willett's to pick that up and take back to their site. A response to a single or multiple confirmed case of COVID will vary by situation due to the varying circumstances. If a camper, adult, or staff member exhibits symptoms indicative of COVID, they will be escorted directly to the health lodge where they will be quarantined and more thoroughly examined by a health staff member. At this time, parents of minors will be contacted and plans made for moving forward. HMSR has identified potential locations which can be used to quarantine and isolate those being identified as having COVID or have been in close contact with someone who has been diagnosed as possible. Besides using resources from the CDC, the American Camp Association, the Bsa, HMSR will also use other resources available to us. Our board, our risk management committee, and our council health director. All of our policies and procedures will be approved by the risk management and board. Again, this is a fluid document. This is something that is changing as the science changes, and we will keep you updated. If you have any questions, please feel free to contact me at michelle.beeman@scouting.org on your screen. We are still looking for staff who want to make a difference this summer. Summer is over, and what did you do? Did you touch the life of a child or two? Were you patient and thankful for each passing day, those filled with sunshine and those filled with rain? Yes, summer is over, but not in my mind, for the memories of people will last a lifetime. Come work with us. Come see what it's like to work with kids at camp. It's a wonderful, wonderful job. Just go to www.hmc-bsa.org and fill out the application. Thanks, and I hope you all have a great day.